Well, hello again, everybody. Welcome back into the Keep Boone Healthy Community Information Channel. I'm David Jackson, President and CEO of the Boone Area Chamber of Commerce. Happy holidays to you and yours. As we get into the spirit of gathering once again and moving about our community, we felt like with all of the things that are topical once again in our COVID news digestion, if you will, we thought it would be a good idea to get our community experts back in front of you again here as we move toward the holidays and talk about some of these more national conversations or statewide conversations in a little bit more local context. So once again, we are joined by Jennifer Greene, Director of Public Health for AppHealthCare and the CEO there, along with Sean Burroughs, the Director of Pharmacy for Appalachian Regional Healthcare System. Jen, if we can start with you, just kind of a general overview on where you see things in terms of COVID and case load right now here in our community. What do you have that you can update us on there?
I'll just say, David, happy holidays to everyone. Merry Christmas. And I know COVID rising up again is not the gift that we all wanted, but we do have tools this year that we didn't have last year, or we were just beginning to have around this time last year. So I think while I want to just urge caution because we do have more cases, our positivity has gone up, our case rates have gone up. We certainly have COVID circulating in our community, just like many other communities across our country. But we do have tools. And so I think while we're all tired, it's important to remember that we do have some tools that can address COVID. And one of the most important ones is, of course, being vaccinated.
Sorry, didn't unmute myself there, forgetting my Zoom rules. As we look at some of those tools that are available, Jen, one of the things that was spoken about yesterday in Governor Roy Cooper's comments to the state was about testing and just reminding folks, if you will, that not only is testing more widespread than it was at this time last year, but there are different points of availability for that, including at-home testing now. What can you tell us about testing availability and how you and your team have helped make that a priority here again during a time where we've seen numbers start to go up?
Well, we really appreciate so many people joining in on the testing front. We've had a lot of support with lots of local providers, our local pharmacies who have even made test kits available for purchase. And I think we really want people to get access to testing. We're still offering testing at the health department in the mornings, but we know that people may be traveling. They may need access to testing. So you can go to our website, apphealthcare.com. There's a link on there on the main page where you can order an at-home test kit. So we just encourage people to get tested, particularly if you have symptoms, you want to stay home. But even if you don't have symptoms, if you're traveling, it's a good idea to be tested and make sure that you're paying attention to that. I think all these tools are going to add to our ability to combat this virus. So we're grateful to have the access to those tests. We have been getting some rapid tests from the state health department that we've been using for some time now. But really, truly, those at-home kits are also a good tool. And so we encourage people to just make sure you get access to testing however you choose.
Sean, as we bring you into this conversation, a lot of people often look at one of the community benchmarks in terms of COVID health being hospital capacity. What can you update us on from Appalachian Regional Healthcare's perspective on where you all see your caseload right now?
Yeah, we before December hit, before Thanksgiving, we were in the single digits as far as the amount of folks that were admitted to the hospital. And then after Thanksgiving, our numbers had gone up somewhere between probably 12 to 14, and then recently this week we've gone up to 18 people in the hospital. Again, the majority of those are unvaccinated folks. We have 14 unvaccinated and 4 vaccinated. So our caseload is rising, and it's something that we're planning on seeing probably through January, maybe February, based on what we saw last year. We had a really busy January and February last year after Thanksgiving and Christmas. So just like everywhere else, I think we're seeing more cases here. and again, the I couldn't stress is that it's vaccination seems to maybe not necessarily help you not get COVID, but the folks that come into the hospital and come into our ICU and get put on ventilators, the vast majority of those folks are unvaccinated. So that's always the message that I try to send out to everybody that asks the question. It's our caseload's going up, and the sicker people, the majority of the sicker people that we see in the hospital are unvaccinated.
Sean, the last time that we talked to the two of you, we were really at the forefront of the booster shots being distributed around, and now even more people are eligible to receive those shots based on the timing from their COVID vaccinations. Have you heard anything from the pharmacy side of this about how people have dealt with those shots? Are they presenting with similar side effects as maybe the first or second COVID vaccines were, or just any data that may help allay any trepidation by anybody as to whether or not to get that booster?
Yeah, I think folks will need to prepare to feel similarly that they did with the second shot. And if they're lucky enough, like me, I got my booster. I made my bed in the basement. I'm like, all right, I know 12 hours is coming where I'm not going to feel well. So I was fully prepared, and I didn't have one single symptom. And there are others that have felt like they did when they got their second dose. So it really varies. It's hard to tell what's going to happen and who's going to have those side effects. But again, they're very transient, just like they were with the second dose for most people, and that they occur about 12 hours after your booster, and then they last for about 12 hours on average. Now, some will last a little bit longer or less, but as a general rule, it's similar, but maybe not as bad for some people as it was with the second shot.
Jen, I know that as more people make their way to our community and more people gather here in the community during the holidays, a lot of times people like to look at data to see how a community is performing in some of these COVID metrics that have become all too normal for us all to digest. I know that you have changed some of the available information on the dashboard through AppHealthCare. Can you just give us kind of an overview as to what people can see and how they can achieve that knowledge of understanding how COVID is impacting Watauga County versus just listening to a national narrative and assuming that because it's bad somewhere, it is equal here. That isn't always necessarily the case.
Yeah, I think one of the best tools we have for seeing how we're doing is looking at our situation report. It's really a point in time. It gives us a snapshot of lots of data, both on how we're doing with vaccines in our community by age. But one of the things that we've added is actually looking at our new cases and how many of our new cases are actually among unvaccinated, not because of any reason except to just help people understand the risk that comes with not being fully vaccinated. So our latest report actually showed 80% of our new cases had not been fully vaccinated. So cannot stress that enough. That is one of the most important things that we are trying to encourage people to pay attention to. But you can see our case information on the dashboard. But in that report, there's a lot more information that will tell you over time how we're doing. There's also a snapshot in the beginning to kind of tell you, are we going up? Are things leveling off? It's meant to just help us all understand where we're headed. And I think, like Sean said, we are expecting things to increase after the holidays. And we, of course, have heard a lot about Omicron. And so lots of reasons to expect increases. And I think that's one of the reasons we are trying to really emphasize all the prevention measures, wearing a mask indoors in public spaces, and then, of course, getting vaccinated and boosted are really important.
And I think that's where I'd like to close and give you all both an opportunity to just answer this question for people that may still be on the fence about what their holiday plan should look like, whether or not they should interact with family members, what they should do in terms of mode of operation. What is your best advice in terms of following information or just procedures that you would encourage? And maybe Jim, we'll start with you and get Sean's take but before we end our conversation here today.
Well, I think one thing you can do is you can get tested before you go gather with family and friends. If you haven't gotten your booster shot and you have the ability to do that before you go, certainly we think that's so important. Don't put it off. Make sure you make a plan during the holiday time to get your booster shot. And if you've not been vaccinated, you might want to think about travel if you've not been vaccinated, because you do have a higher risk of contracting COVID. I will just say we know people want to be around family. So I think, trying to combine strategies by, getting tested before you're traveling 1 or 2 days, not too far off from when you're going to actually travel. Monitor yourself for symptoms. Don't push aside any mild symptoms. I think we are typically, trying to push forward through a lot of illness. It's not the time to gather with others if you're not feeling well. Make sure you, follow the stay home if you're sick rules if you can. And then, make a plan to get your booster shot if you haven't done that. And it's not too late to start your vaccine effort. If you have not been vaccinated and you want to begin, I hope that you'll really make an effort to do that, because that's one of the best ways for us to get past this. And especially with Omicron spreading, we know that being vaccinated, as soon as possible is going to help prevent severe illness and death. I also would say, lastly, I know people are not a fan of masks. I don't love them either, but they are a helpful tool if you're going to be in indoor spaces in a public setting. It's a good idea to wear a mask.
Sean, anything you want to add to that?
Yeah, at this point in time, I guess my message would be, listen, I don't want to live in fear of going places. I don't want to live in a bubble either. So I just feel more confident that myself personally and my family has been vaccinated, so that if we do go to a gathering with family members or wherever, I feel somewhat of a comfort level of thinking that, if someone in my family does come down with COVID, we've been vaccinated. So our likelihood of being hospitalized and being severely sick goes down significantly. So it's almost like a comfort level for me saying, all right, I'm still concerned about the transmission of COVID. I'm still concerned about getting it, as well as anybody in my family. But since we've all been vaccinated, it does make me feel better that we can still go out and do some of the things and gather as family, and not be as fearful that we are risking severe illness coming down. That's not saying it can't happen at all. I'm not saying that at all, but it's less likely to be a severe illness if you have been vaccinated. So I've been waiting for 6 to 9 months to come on your show, David, and be able to say, listen, this pill, this injection, this infusion just came out, and it's going to change the landscape of somebody that's been infected with COVID. And as much research has been done through all the different manufacturers, it's just not there. Usually as an illness progresses, new and better treatments come out each year. Our best treatment is prevention. There's just not a treatment still, not a good one. And I've seen the news, and there's lots of information out there, but it's just not, they're not great. None of the options that are out there are great. Your best defense against COVID is preventative measures, just as Jen said. Get vaccinated, get your booster. I know people hate masks. I don't like masks. I know there's a lot of concern about masks, and I'm really proud of our school board for continuing to keep masks in the school. And I know that some people don't like that, but it really has helped decrease transmission. You can see that the numbers are there, and social distance. So treatment, there isn't a good treatment for it. The best defense you have against coming down with COVID is the preventative measures of getting vaccinated, masking, and social distancing where possible.
Well, and I think I would follow up on both of what you said, and just say that it is important not to believe everything you hear right now. And believe me, we've heard it all here as we have new folks coming into our community to spend the holidays, and others calling around. We've heard everything from the state's going to shut down again to we're all going back into this period of isolation. And folks, I'm here to tell you that there's just no sign at this point in time of that occurring. We heard Governor Cooper say yesterday in very emphatic terms that there is no current plan for any kind of statewide systemic shutdown like we saw back in March of 2020. The simple fact is that we have, as Jen mentioned earlier, more tools available than we did in March of 2020. It doesn't have to look like that again. Now, with that said, that doesn't mean that we throw caution to the wind either. As we continue to remain responsible, practice prevention, practice the things that we know can be effective, we can limit the community-wide impact operationally that we have seen that have caused some of that disturbance, if you will. So we continue to see businesses not operating at full staff. We continue to see disruptions like that cause differences in hours and operation, not only for our business community, but for our just lives in general. So the more responsible you are, the more that you can continue to prioritize vaccination, prioritize those preventative measures that can keep you and your family healthy, the better chance we have at maintaining as normal of an operating community as we possibly can. Because again, there is no political will currently, nor there are no plans to see any major disruption to life as we know it right now. So we've been talking about for a while now, we have to figure out a way as a community to come together and deal with dealing with this, right? So this is an opportunity to do so, practice the things that you know can be helpful, and hopefully minimize the impact that we see on our healthcare community and others around our community as we continue to move into 2022. So Jen, Sean, thank you so much for your expert opinion. Again, I appreciate your willingness to share context of how things are here versus what we just see and hear and digest from all over the country. It's great to know that you all have continued to stay at the forefront of a lot of the reason why we have been fortunate here in this community to maybe not see some of the impacts that others have around the country. So thank you for your time and your efforts, and we hope you both have a very safe and happy holiday.
Thanks, David. And I'll say happy Vaxiversary. This is our 1 year mark in time that we have a vaccine anniversary. So congrats to everyone who's. I
feel like there needs to be a cookie or something that comes along with that, something. We'll figure that out for next month. But appreciate everybody tuning in, and have a safe and happy holiday season, and we'll talk to you again soon.